And the second will have Ivan. Ivan is also our partner. He will share the immigrant worker in Taiwan during the COVID-19 their living limitation and how they fight for it. And the third part we will welcome the physician Ming Wei. He will introduce his research about the women occupational stress to the female nurses or female health care workers to share how they deal with their guilty and their stress and their cycle stress. And the last part we will welcome George Hong, who come from Australia, but maybe he has some technical problems, so he didn't show up here now. But later we will invite him as a speaker to share with you. And if any one of you have any question, you are welcome to raise your hand and ask question. But first of all, I have to say, because all of us not English native speaker, so if you are welcome to type your words in the chat box, and we will answer it later. Okay, so first one will be my part. I will share my slide with you. Yeah. Okay. Okay, sorry. We need to wait. Okay. Okay. My part will discuss about the young girls' lack of STD prevention and the psychological resilience advocate. I'm Zongtai Yoyo. I'm a career. I'm an educator. I'm a people who live with HIV peer worker. So I focus on the HIV issues and the advocate for a long time. This year during the COVID-19, we found there are also some problems, some issues to the young girls and the women. They are lack of the prevention, and they are face a lot of stress to let disease infected. So in my part, we have some project. We want to get more resilience, and we want to advocate for them. Yeah. My outline is my outline. First, I will share about the Taiwan people attitude to sexual health on young girls, and also I will introduce the law and the resource the young girls or the people will have in Taiwan. And the second part, I will introduce the before the pandemic and after pandemic, how we do and how we work with the young girls. And after the pandemic, we will share what we do. There are two parts. It's cool not shame to discuss the sexual issue public. And the second part is how we deal with the parents. Sometimes parents are refused to let their daughter or their son to receive some sexual education or this kinds of education. So we are trying hard to communicate with the parents group and the community. And the last part is our strategies and our partner. Okay, what we do about the HIV and the STD issues. Okay, these are some pictures I show you. It's writing in Mandarin. They are the words says people are crazy because they want to same-sex marriage, and same-sex marriage will cause a lot of people who live with HIV. Or some people say people from Thailand, people from Indonesia, people from the Asian country, from the South and East Asian country, they will take HIV to Taiwan. They will waste the resource of Taiwan's medical resource. And very clearly, we can know it's very shame, it's discrimination language and the hate speech. But we don't know why. Many Taiwan people, they will think it is very popular. So we want to do some change. Okay, and also I will share this with you. The lady as my right side is Lady Peng Wanru. Peng Wanru was an active advocate for women's safety and women's rights, and unfortunately, also she was a victim of murder and sexual assault. And it's very very sad. A woman who are strongly advocated, but she was died from this issue. So after she died, the next year, the Taiwan government, the 立法院, passed a law about the Sexual Assault Crime Prevention Act. And in the same time, after the months, they also passed another way. It's called Gender Equality Education Act. This act want to make all school to teach students. If you are a boy, you cannot hurt a girl. If you are a girl, you have to watch out because all the boy will hurt you. It's very weird in our time now. It just focus on sexual assault only, and didn't discuss too many about the gender issue or the equal issue yet. And after 2000, Ye Yongzhi, a famous name as Rose Boy, 玫瑰少年, he was died in school toilet. You can see his picture. He was a junior high school student, and he was long-term being bullied by his classmates. The teachers know, and the people know, but nobody do anything. And also they tell Ye Yongzhi's mother said, that's because your son is a sissy boy, so people hurt him or bully him. It's very fair. So after Ye Yongzhi died, Taiwan's government and many advocates and NGO workers, we are fighting for it. So in 2001, we passed another Gender Equality Education Act. And this time, it's inclusive of gender temperament and the other gender issue and so on. And it's our law has very clear to announce that people have to teach it. But on 2011, the Minister of Education announced again, all schools should teach STD prevention and the sexual reproductive health in school. Why he announced again? Because there are many schools they don't want to teach. They don't want to teach the young girls and the young students how to protect themselves. Some school will teach the student sex is shameful, and if you are a girl, you have sex with anyone who are not your husband, and you are shamed. And if you are pregnant without married, if you got the STD or some disease, you are be very shamed, and that's all your problem, and you should not come to school again. These words are very popular in many schools 10 years ago. So nowadays, after the Minister of Education announced, now when all schools have to teach the STD prevention and some other issues. But even we have a law, but you can see, let's troubles I found it from our Taiwan's gender database, and we can see that all number the childhood victims of child and youth sexual explosion, they are hurt or they have some issue and they will report. You can see very clearly when men are 23 and the female are 465, it's almost 20 times. So now we have the law, but while the young girls or the students, they still have these kinds of problem or issue. That's why we want to do more. Also, in this way, you can see the victim of reported case of the sexual harassment after the 10 years after the law was made. But you can also see the there are more and more cases reported. But maybe it's in another way, in a good way, maybe the case can be reported. But because in the past time, people didn't dare to say they got some damage or they got sexual harassment. Okay, so before the pandemic, we do a lot. We do the fake news and hate speech formula to discuss with the teachers or the parents. And also, we do the B project is the high school young student workshop. We collect a lot of young students to discuss how can we do to eliminate the discrimination language and how can we do to have a gender-based friendly school. And also we do the expedition about the discrimination speech. Not only the HIV, but also the gender issue, but also the migrant worker issue for a long time. But after the pandemic, because so Taiwan didn't have lockdown, but also we have some problem. The school refused to teach the unnecessary class because they will think the STD or the sexual issue is not the most important because the time is very precious. So if they don't want to teach it. And also all the workshop and all the people who live with HIV peer community were closed because our government's afraid that people getting together will easy to spread the COVID-19. But also in this way, many people cannot access to the resource or the support. And the third one is the hospital resources are limited because all the hospital resources are directing to the COVID-19 issues. And the last part is the hate speech and discrimination to migrant workers getting more and more and bigger. People in Taiwan say that migrant worker will bring COVID-19 virus from their country, and it is very it is not very fair. But people a lot they think about it and they speak about it. So what we do during the 2020, we do some we try some new project. The first one, we go to the school and we collect the student. We trying to do some workshop or some activity that make people to discuss about the discrimination, talk about the sexual health, or talk about the LGBT issue, and make people think it's cool, not shame, to discuss about it in public. And in this way, many young students, they are there to ask, they are there to discuss, and they are there to ask the teacher, if I want to get some more information, how can I got from school or from the NGOs? And it's a very, it's a wonderful project. Second, because in Taiwan, if we are talking people that we want to discuss about the sexual health, or when we want to discuss about the discrimination, the student or the parents, they are not very willing. So we use the SDG issue, combine the civil education, and let the parents and the young student, they will think, oh, it's very cool, and it is because it have the SDG project. Is connected to the UN issue. So people will want to come to our workshop, and we create a safety environment, make students to discuss and make them to do the parent teacher. Yeah. And the last one is we make a lot of effort to work with the parents community, because sometimes the most stress from school is come from the parents. They don't willing to make their son and daughter to learn about STD issue or to learn about the discrimination issue. They will think it's not necessary to your college or to your high school. So we communicate and we work with the parents community. And while parents community are let's say okay, so we can do the next step to work with the young student. And it is very okay, and it is powerful to make our project can run. And also we advocate with the neighborhood community. We go to the community in neighborhood to work with different people to make them discuss about discrimination by some volunteering workshop. Yeah, and such as this time, the left side in the pictures, they cooking for the elder people, and in the same time they will discuss about the migrant worker, and they will discuss about if some elder people are people who live with HIV and nobody care about them, or like don't get the health care from the government. How can we do? Yeah. In our project and during the pandemic, we do a lot communicate with the government, with other NGOs, and with the school, and we combine this SDG issue and the CEDAW issue to make the all student and the teacher and the principal of school, they are known as civil education, not just about the HIV, not just about the STD. So they are willing to make the student to work with us, and they are willing to share their afraid or their feelings or what they are worried about. So it's very cool to of us and to the school principal and the student and the parents community, and it's worked very hard and very successful. So it's our chance. Okay, this is our partner. We work with the Mental Health Association in Taiwan and other HIV story association who are working with the people who live with HIV and speak and advocate for HIV. And there are another partner who is Ivan. Later, he will introduce himself and what he do. And also the Taiwan GD, because we try to connect with other NGOs and not only the school, so we can do some activity and very successful. So it's our Taiwan's experience during the pandemic. And in our activity, we are trying to make the student or the young girls, the women, they can access to some STD resources, and they can have more positive attitude to some STD issues or to some discrimination issue. They are willing to discuss, and we can have our next step. And this is my part. And if you have any question, feel free to raise your hand or type in the chat box, and later we will share. We will respond later, or we can discuss later. And the second is we'll come to Ifan to share with her his slide.
Hello, can everybody hear me? Yeah. Ifan Fan, I'm from Harmony Home, Taiwan. My topic today is the living limitation of migrant worker in Taiwan under challenging COVID-19 epidemic. And I will introduce myself first. Wait a second. Okay. I'm the Executive Secretary of Harmony Home, Taiwan, and I'm also the Executive Director of Taiwan HIV Story Association. And I'm dedicated to healthcare services for migrant workers, children, regardless of nationality, and people living with and affected by HIV/AIDS for several years. And Harmony Home Taiwan is founded by Mrs. Nicole Yang in 2011, and who had begun help people living with HIV/AIDS since 1986. And our organization is committed to providing care services, treatment access, and support those people who living with HIV or affected by HIV/AIDS, and also the migrant workers and foreigners with difficulties. And you can see the picture, that's our founder, Nicole Yang. And the picture below is that we support the migrant worker mothers to go back to Indonesia with her children. And our service can divide it into 4 dimensions. The first one is we take care of children regardless of nationality. And we provide 24 hours care every day. And we help the children access to healthcare settings. We help them go to the hospital and help them find resources to help them access to the treatment. And also we help them access to schools and other education settings. For example, we will help them to go to the kindergarten, and we also find the teachers to teach them their mother languages. And the fourth is that we help the mothers to go to the hospital to have the evaluation of their condition and related care services. And we also help them have delivery. And the second part is we help the people who living with HIV and also their family. We provide shelters and daily necessaries. And we also help these people access to treatment. And the third is that we help them to relieve the burden of their family, because most of their families cannot take care of them very carefully. So we will help their families to take care of them, those people who living with HIV/AIDS. And we also reduce the extra expenses of the National Medical Service, because once we provide these services to those people who living with HIV/AIDS, the government or the society can reduce the expenses on those positives. Yeah. And the third service is that we also have the campus campaign. We provide the knowledge of HIV prevention, and we help to raise their awareness of HIV. And we also aim to reduce the stigma of HIV/AIDS. And we will have around more than 100 campus campaigns every year. And the fourth part is that we also help the foreigners with difficulties. For example, those foreigners may be living in Taiwan, and maybe they are sick or they have cancer. Then we will help them access to the treatment or help them to get the evaluation of their condition. Also, we can shelter them if they have no place to stay. Yeah, and also we help those foreigners to the legal services, because some of them will have some legal problems. Maybe they will have some physical offended, or they have beaten someone. Then we will help them to solve this problem. And we go back to the topic. We will talking about the living limitation of the migrant workers. And I will focus on those undocumented migrant workers, especially women. And you can see the chart that we have around 50,000 undocumented migrant workers in Taiwan. The data is January 2021. So we have more than half women, which are undocumented migrant workers. You can see there's 31,000 undocumented migrant workers are women. Yeah, that's very huge number, because these women will come to our place and ask for help. And we will help them the cases is around maybe 1,000 every year, including their children. And I will talk about the non-Taiwanese children in Taiwan because these migrant workers, undocumented migrant workers, they have faced some problems and their children will become non-Taiwanese children. The first part is that they may become stateless children. And the second part is that they might become undocumented children. So what is stateless children? The children is from or of stateless parents because their parents are stateless. So these children are stateless too. And another situation is that their mother, the children's mother is marriage immigrant women. These women come to Taiwan and get married with Taiwanese men. And they want to become Taiwanese citizen. Then first they need to renounce their original nationality. And the second step, then they can become Taiwanese. But once they become Taiwanese, there's still some problems to these women because once these women violates certain kind of regulation, the government or the authority might denationalize the Taiwan nationality of these women. So these women become stateless once they are denationalized. And if their children was born in this situation, their children is also stateless. And what is undocumented children? It is that the parents with unlawful stay and residence make those children undocumented, such like undocumented migrant workers or the foreigners, because the migrant workers maybe they will run away from their employers and their employers will inform the government so that these migrant workers become undocumented. So once these migrant workers become undocumented and they also have children, their children will become undocumented. And the worst condition is that they have their baby without a birth certificate, because many of these migrant worker women may choose to have their baby in their own place, their apartment, or everywhere they stay, maybe their illegal employer's place, or maybe a farm, or where they live in the mountains, something like that. So the government won't know these children exist. So the children cannot share any benefits which government provides. These undocumented children will face some problems. The first part is that they will face, they need legal residence. And the second part is that they need health care. And the third part is that they need education and development. And the legal residence means because their mother or their father, their parents are unlawful to stay in Taiwan. So these children cannot allow to stay in Taiwan legally. So, and also the government didn't know that those children exist in Taiwan. So we cannot provide any resources to these children. So the most important part of these children is that we need to find these children. Where are these children? Or their parents should come to the CSOs, the MPOs to led us to help to make to know that they have a children and they need help. And once they show up, and they might be need health care, because once the undocumented migrant worker, especially the women or the mother, they need to have the evaluation of their body and to know whether they are healthy or not, their children or their baby are healthy or not. But once these children, once this mother become undocumented, they cannot share the national health insurance in Taiwan. So they have to pay all the expenses of their medication, in the hospital, or the medical supplies, and so on. So it is very high prices for this undocumented migrant worker mothers to pay this payment. So they will avoid to go to the hospital. And also if they have baby, they have children, they will avoid to take their baby or their children to the hospital. So many children or baby become ill or have some conditions, but their mother cannot take them to the doctor. And the third part is that they need education and development, because under certain situation, their parents, especially their mother and their father, cannot taking care of them very carefully, or so the children need more interaction with their parents, with their friends, with their other people, but their parents are busy working. So the children need someone to teach them or make them more reactive or have response to other people. So not only undocumented migrant workers have unlawful residence, also the asylum seekers or other undocumented foreigners face the same problem. And you can see the circle in blue, that means which national health insurance covered. And you can see the yellow circle, that means that migrant workers, and you can see which not covered by the blue circle is that undocumented migrant workers. So for this part, they cannot share all the benefits or resources which government provides. And all we can do, the Harming Home Taiwan can do, is to cooperate with those CSOs, MPOs, or you can say the civil society in general. And also we will cooperate with the welfare department, the social department. They will transfer the children and mother to our shelters, and help us to provide services to those mother and children. And also we will cooperate with the immigrant agency, because they have some problems of residents to solve. So we will cooperate with the immigrant agency to help to solve the residents' problem. You can see this is our service. It is our new shelter, new children's shelter in Taipei. So we will teach them, help them to have meal, and help them to access to some learning or education activity. But during the COVID-19 epidemic, the migrant workers face some problems, because it is very, very, very cautious to our government. The first of all, that the government asked the hospital to control how many people to enter the hospital or which people who can enter the hospital. So we use our national health insurance card to check everybody's personal information. You can see the picture that which look like a chip card. So there's a chip on the card, and the hospital can read the chip once you go to the hospital. So they can know who you are. Have you been travel to other country in the recent maybe several months, and they can also know about your occupation. Are you care service professionals, or also you are working in a hospital, and also they can know who you contact with. So if you contact your family are those who are at high risk of COVID-19, they will avoid you to go to the hospital or enter the hospital and ask you to stay at home to check whether you might be infected or not. And also they will check whether there's have some potential infected in your society. So they use this card to check every information of your personal information. So the migrant workers and the especially the women are avoid to go to the hospital because they have no legal identities to go to the hospital. So they will avoid to go to the hospital. And we also use the card, the chip card, the national health card, insurance card, to buy the face mask. So the migrant workers cannot get the face masks because once they become undocumented, they cannot use their national health insurance card to go to the hospital or go to the pharmacy to get this prevention. But our governments have some response or react to those undocumented migrant workers. Our Ministry of Labor and Ministry of Welfare, Health and Welfare, holds checking migrant workers' residency. That means our government knows that undocumented migrant workers need health care, and we need those undocumented migrant workers to provide care services in the hospital. So they promise to hold checking migrant workers' ID if migrant workers need to go to the hospital. And also they ask the hospital to provide face masks for undocumented migrant workers. So our government later have sufficient face masks in the markets. You can see in the slide that in our convenience store, they have a lot of face masks, and they don't need the migrant workers to have the card to insert to check all the information to buy this mask. Yeah, so in general, migrant workers affected a lot by those information checking. Yeah. So wow, thank you. It's my presentation. Thank you.
Lena also we have a guest. Lena also share his information. Lena is working in an NGO in Auckland and working with the UNHCR about dealing with the refugee issue and help like refugee issues. It's such as the Ifan said in before. And if we have any question or people also can contact with Lina if we want to know more about the refugee issue in Auckland. And I wonder the undocumented migrant worker issues is also such as sometimes are similar with the refugee issue because they don't have the identity ID card in their country and they are temporary without the country's protection. Yeah. And then next, we will welcome Mingwei to introduce the occupational health to the female health care workers and their duty, their stress, and their cycle stress. Let's welcome Mingwei.
Hi, everyone. I'm Mingwei Lin, and I'm a psychiatrist specialist and a PhD student studying about health policy and management. Today, I'm going to talk about the psychosocial stress of healthcare providers during the COVID-19 pandemic and its negative impacts towards female. It's about workplace mental health and disease stigma. This is the outlines I'm going to talk about. First, I'm going to talk about the SARS experience in Taiwan. As we all know that the experience of SARS helped us to do very well in this infection control during the COVID-19 pandemic. But also it provides a lot of information about the disease stigma or some psychosocial stress for us to know about this topic. And then I'm talking about the source of psychosocial stress during the COVID-19 pandemic. And then I'm talking about some results of my interviews to some healthcare providers, including men and women. And mostly I'm focused on women's experience. And last, I'm going to have some discussion and suggestion. This is our experience of SARS, which also means severe acute respiratory syndrome. It happens in 2003. And all over the world, we have about 8,096 cases. And in Taiwan, we have 346 cases and with 73 deaths. And also the famous event in that year is that we closed a hospital, which named Heping Hospital. And it was closed very suddenly by our government. So many people was locked inside and they cannot get out of the hospital building, including just walk by or just getting to borrow the toilet or something. The time they close that hospital, you have to stay in there until they open it again. It has very some severe negative impacts because so many cases was in that hospital. So everybody was locked in and they are very stressful and afraid of being infected by anyone in that hospital. And people are seeing that this hospital was the source of SARS. So some people are very lucky when they have holidays that day, so they don't have to go to work in that hospital. And some people are very depressed, stressful, just because they have to work that day or they just working that day to visit a clinic that day. No matter what, they just go into the hospital building at that time. And based on this experience, there are so many researchers talking about the stigma or the psychosocial stress about during the SARS. So in many literature or research, they have found that disease stigma is one of the major sources of stress. And the healthcare providers have other sources of psychosocial stress, like risk of get infected, or they have the risk to transmit this disease to their relatives or friends. And they have faced the work change, like they might be work in a surgery room, or they don't have to face the infected disease when in their original workplace, but in that time they are forced to taking care the infected people because the working loading are increased so suddenly, so they have to transfer people to that section. And the loneliness is very important because fear of get infected or transmitted to their relative or friends, they somehow choose to lock themselves or avoid to meet anyone in case they might be infected that time. The third research is about when they found people are less perceived of disease stigma. They have better income. When they have better income, education, and social support, they are less perceived of disease stigma. In other words, when people are better income, or they have better social resources, or they have better social support, they may be less they have minor impact of the disease stigma, or they have less psychosocial stress. And many people may think that even after the disease or after the pandemic, the condition may improved, but the research tell us that the negative mental health impacts persisted even after self-isolation and rest. So it is not only it is not the disease are stopped or the pandemic are stopped. The psychosocial stress are stopped. Their negative mental health impacts persisted. If we don't face it or we don't deal with it, they can hurt people even after the pandemic. And the first-time healthcare providers and perceived disease stigma are both related to higher risk of mental illness. So that's why we are talking about the healthcare providers and the disease stigma during the COVID-19 pandemic, because they are in a high risk of getting mental illness. This is the table of the SARS experience research. We can find that even after 1 year follow-up after the outbreak of SARS, the healthcare workers are still under mental illness. They have much more stress, much more depression, much more anxiety, and much more experience about PTSD syndromes, even after 1 year. We can see that those non-healthcare workers, 1 year after the outbreak, many people are recovered very well. But in the healthcare workers, when they have to face the disease in the first time and providing care to those who need it, they are under very, very, very strong stress. And even after 1 year follow-up, they still get much more stress, depression, anxiety, and PTSD syndromes. That's very sad. So we are going back to this COVID-19 pandemic. We are famous in this infection control because Taiwan did very well in so many parts. So we are the infected cases and the confirmed cases is very, very, very small. So in many articles I've talked about, we did very well in this infection control. But when we have these cases, it's equal to we are free from damage, or it's a worldwide pandemic, we still in danger in some part, not only get infected. Of course, the answer is yes. That's why I'm here and talking about this topic. Because I think it is because we have the experience of SARS and we did very well in the physically infected case control. So we have the space to see what, why, and what and how disease stigma have some negative impacts on people, especially on the healthcare providers and female healthcare providers. So here is some source of stress from from a lot of articles they are talking about, like during the COVID-19 pandemic, their working loading are increased very, very largely, and they are anxious about being infected, including they are wondering if they can get help when they are getting infected. And the third part is the psychosocial impact, like work-family conflicts. Many people are talking about. It's like you have to work, and the healthcare loading is increasingly very, very, very large, and you have to provide to your family because some of your family don't have to work or they are isolated. You have to provide care to them. So there are lots of work-family conflicts during this pandemic. And the last part and the major part I'm talking about is the disease stigma. Because in Taiwan, the case number is under control. So there's not so many cases. So the workloading not change so dramatically like other countries, but the disease stigma did have influence to our life. So why are women so unique that we have to talk about today? The workplace healthcare providers are facing the psychosocial stress and facing the disease stigma was proved in previous articles and researches. But in Taiwan, I think in Asia mostly, women has a unique role in our society that even they have a full-time job, they have to take the responsibility to take care of their family, especially when they are getting married or they become a mother. They have to take the responsibility to providing cares to their fathers, their parents or parents-in-law, their husband and their children. And it's just like a second full-time job. So when they have to providing these care works to their family, the frequency of contact increase. So when they have to providing care to those patients who are get infected or those in risk get infected, they are labeled by other people, not only their family, but also their neighbors, relatives, friends, that they are those people who are high risk of get infected, or in some people's opinion, they are the potential source of COVID-19 virus. So when people see them that way, they are trying to avoid that. In my interviews, that some mothers talk about that before this pandemic, they have to bring their children to school or bring them children to a park, and that their children play with their neighborhood or friends or classmates. But after the pandemic, after the neighbors or their schoolmates, parents knows that this woman or this child's mother work in hospital, they are asked to avoid these children or to avoid this family as far as possible to keep themselves safe. So people are label this family a high-risk family, and this mother or this housewife feel very guilty. They have very strong guilty feeling about they bring that label to their family as they are risk or source of a COVID-19 virus. So I think the major part is that the people around them seeing them that way, but these people, these caregiver providers or these healthcare providers, even they have very professional knowledge in providing care, in medication, in taking care of infected people, they cannot stop thinking about that. They are high risk of get infected, or they have the possibility that they can transmit this virus to their family. So most of my interviews, especially recently, we have in hospital infected cases. Those healthcare providers like nurses or respiratory therapists, when they go back home, even the government or the hospital tell them that they are safe and they can go back home. When they go back home, they try to isolate themselves and not to contact with their family, including their husband, their children, their parents-in-law, or their friends. So not only the people around them to seeing that they are very risk or they are a potential infection source, they are seeing themselves as a potential source of high risk, or somebody said like a virus carrier. So they try to lock themselves and isolate themselves. And in that way, we all know that in Taiwan, these women have to take the responsibility of providing care to their family. But when they choose to isolate themselves, they cannot do a job of a caregiver or a mother. So they have to, their husband or their parents-in-law have to take over this job, like taking care of their children, preparing meal, or taking their children to school, etc. So not only seeing themselves as a potential infection source, but also they have guilty feeling about they are not a good wife, not a good mother, because they cannot providing care to their families and they cannot fulfill their job. So not only the isolation, but also they cannot do their job they wish they can do, or they do it every day before this pandemic. But during this pandemic, even they choose not to do this job and isolate themselves. They stay alone, but they cannot stop thinking about feeling sorry to their families, to their children, because he might have the risk and they cannot do their job to their family. So the social stigma and the self-stigma did play a very important role about increase the psychosocial stress, and they can bring so many negative impacts, including anxious and get isolated, loneliness, and a lack of social support and guilty feeling. So they increase the stress and bring some mental illness to these healthcare providers, which play an important role in providing care and in this pandemic time. So when we're talking about health, now we are all focusing on biological because we have so many strategies to prevent people from infected, like social distancing, hand washing, or we encouraging people to wear facial masks. But it's all about biologically. But if we are talking about health, we have to think more than biological. We have to think the psychologically and socially health, because when we all think about the major part of the health, we can get health. So not only wear facial masks or hand washing or social distancing, but also see the psychosocial stress like species stigma. We can improve our health and prevent people from the harm of this COVID-19 pandemic. Not only get physically infected, but also mentally hurted by this COVID-19 pandemic. So here I'm talking about, we are talking about the socially mediated risk perception. I think it's a two-sided sword. It helps people and the government to get awareness of this COVID-19 virus infection. Like people are willing to wear facial masks. People are very awareness about hand washing and keep social distancing. But if the social mediated risk perception are really, really high, they are get fear, get anxious, get insecurity, and get more stigmatization. It's a two-sided sword. If we are using them to warn people to get aware about it, to be cautious, to be do more things to prevent themselves to get infected, we have to see the negative impacts of it, like increasing their fear, anxious, insecurity, and stigma. So thanks for your attention. This is my presentation about the psychosocial stress about during the COVID-19 pandemic and its negative impacts towards female healthcare providers. Thank you for your attention. If you have any questions, you can contact me through the email. Thank you.
Okay. Thanks for sister. We have some guests. Sister Mavi also share her experience in Taichung, and as good Samaria women center for women. They are doing about the homeless women issue in central of Taiwan, in Taichung. And in Taiwan, we are not focused about the migrant worker, the immigrant women. There are also some minority during the pandemic. They are faced the most impact to them. So based on our experience, we hope we can have more discuss about this minority group in Taiwan. And next one is Dr. George Hong from Australia. And because the technical issue by the internet, so he cannot show his face, but he will share his voice with us. George, can you say hi to us? Hello, George.
Hi, can you hear me?
Can you hear me?
Can you hear?
I can hear. Sorry, I cannot hear George. And yeah. Okay. So yeah. Okay.
Okay. Can you hear now?
Okay, I can hear.
Can you hear now?
Yeah, I can hear you.
Okay, I can hear. Can you hear now?
Yeah, I can hear you.
Okay, I can hear. Can you hear? Okay, so I assume now I need to share my screen. It's okay to see my screen now? Okay, so I'm going to here. So thanks for everyone, and I'm so glad to be here to introduce from my perspective as a Taiwanese on experience the war on longest lockdown in Victoria, Melbourne. So yeah, and because please accept my sincere apologize because the internet connection in Australia is really slow, so I might need some help and you cannot see me. And so yeah, so next slide, thank you. So here I am George Hong, and I just reward as a PhD degree. My research interest is about the mental health and health behavior and health promotions. Also, I'm doing the cross-cultural studies between the Taiwan and Western countries. So here, the next. So why on the current status, the COVID-19 in Australia, the case number in Australia is nearly 30,000 in Australia, and compared to Taiwan is really much more serious, but compared to other European country or United States, it's not that severe. The COVID strange index for now, the Australia is scoring at 50.46 right now. So it's because the current status in Australia is shut down all the borders. Without any permission, you cannot enter Australia. So that's why the index is so high at the moment. So thanks. Next slide. So why do I introduce Melbourne? Actually, it's a Victoria State. Well, because Melbourne, Victoria State has the highest confirmed and death cases in Australia. As you can see the figure in the left, that is the source from the Department of Health, Australian government. In Victoria, there is more than 20,000 confirmed cases, and the days death cases is more than 800 cases. Then the figure in the right side, which suggests among the all death cases in Australia, the Victoria state have the highest death cases portion compared to other states. So thank you. Next one. So what happened to Melbourne, Victoria? Melbourne just experienced one of the longest and the strictest lockdown in the world. The lockdown period is from the July to October 2020. And it, as official record, it just have 11 days for the stage 4 lockdown. And the stage 4 lockdown is the greater Melbourne region. As you can see the figure from the left, the pen in the red color is the imposed with the stage 4 lockdown. Other region is Victoria, but is in the stage 3 lockdown. And what do we suffer in the stage 4 lockdown? We only could stay home, and if we do not have any justified reason, just like go out for shopping and exercise, on caring or work. If you cannot work at home, if you cannot work from home, then you cannot. If you without these 4 reasons, you could not go out. You only can stay home. So yeah. So under such a status, such a situation, the mental health becomes a very serious issue for the people in Melbourne, Victoria. I'm going to introduce some mental status during this COVID-19 lockdown, the strictest lockdown. So if you have any questions, please raise your hand or just raise your comment, and I will address your comments later. So next one. So the mental health impact in Victoria, and the mental health has been regularly monitored by the Australian Bureau of Statistics during the COVID-19 pandemic outbreak in Melbourne in 2020 to 2021. I still continue on doing the monitor. This is the latest number of the current mental health impact in Australia. And that in the figure that I create is adapted from the ABS statistical number. There is more than 20% of Australia report their mental health are worse than before the COVID-19 outbreak. And more than 60%, actually is 67% of Australians use at least one strategy to manage their mental health. And interestingly, the women use more strategies to manage their mental health. The percentage is 47% compared to men is on 59%. So let's see how why the mental health, the difference between men and women in the next one. The next one, yeah. So the left one is still the number that from the ABS, the Australian Bureau of Statistics. As you can see, the women are encounter more nervous, hopeless, restless, hard work, and depressed, worthless. During the COVID-19 was the most severe time in August 2020. And after the COVID-19 was relieved in October 2020, they asked the same question again. Do you feel the nervous, hopeless, or restless, or depressed? The women still have the highest rate to feel nervous and the last performance in the mental health status. So when we break down into the Victoria state, so please go to the next slide, thank you. And the next one. So on post-COVID-19, the working state has caused a substantial change. That is the number one after COVID-19. This is the latest report from ABS2. After COVID-19, the men changed their job due to COVID-19 was 11%, while when there was 7.7% of women changed their job due to COVID-19. But if we took focus on the Victoria state as Melbourne, there are more women change their job due to COVID-19. The portion is on, please go back. Yeah, there is 50% compared to Sydney. The blue one is Sydney. There's only 6.6 women change their job due to COVID-19. And next one, thank you. There's another concern that is raised by the UN because women did more unpaid work after COVID-19's outbreak in the worldwide. In Australia, is not excluded. According to the statistical number, there is in Victoria state on nearly 80% women spending more than 20 hours in carrying their children. And in Victoria state, there are 3.8% of women are spending over 20 hours to do the indoor housework, just like housekeeping and cooking, something like that. And that causes us a substantial mental health influence. And next one, thank you. So we know there are cause some mental health problem. And during this time, we see some mental health support. There are some resources that please go to the next slide, thank you. And the Beyond Blue is the biggest support group that provide the mental health support. And they have the website, COVID-19 Beyond Blue. And then Are You Okay is another organization that is checking to make sure they are okay or not. And this one, written in the Mandarin, is the panel that I joined in Victoria because it's a group that is all Taiwanese students try to check and translate all the English information from English to Mandarin to help the backpacker and the student in still stay in Victoria. If they could not understand the English policy quite well. So we use this platform to provide some assistance. And this platform will also provide some strategy to help them to manage their mental health. So this is the mental health support resource in the Victoria state or the worldwide in Australia. So please go next slide. And in the gender, let's talk about the gender difference. Women, generally speaking, women have the high, compared to the men, they use more management strategy to about handling their psychological stress. They tend to organize their life to enjoy both things, do some positive thinking, and do some yoga or mindfulness. But at the same time, they taking on more on prescription medication as well compared to med. So next one. So now in Australia, in Victoria, we living like a life in Taiwan, the COVID safe. And after the last year, we just suffer from the COVID, from the lockdown, the strictest lockdown, and they have some breakdown or meltdown moments. And after this storm, and the question is asking on all the people in Australia. This question is about how do you think about your mental health in this January compared to the outbreak before COVID-19? Interestingly, in Victoria State, they think their mental health remain the same or higher before the COVID-19 outbreak. So it's worth to further discussion why Victoria's resident, even suffer from the lockdown, they still have more positive thinking in this way. So next one. So yeah, they have more to review about the current status. It is urgent to conduct further research to untangle the mental health impact from COVID-19 in gender difference, in the lifestyle factors, social determinants of health, and after the COVID safe stage, like the Taiwan and Victoria State, when we are experiencing the COVID safe era, what is the difference in the mental health, health and well-being, and that is more research need to be done. So thank you, and I apologize. Please accept my apologies to cause such turbulence during this presentation. And this is the picture that I captured from the news. That was it, because in this period, Melbourne was experiencing the curfew, and there was only one tram in there. There is prohibited to go out during the curfew, and if we are still amidst this story about COVID-19, and we do not know how it will end, and we are just here to witness how about this COVID-19 will develop. And if you would like to contact me, here's my email, or you can follow my Twitter, that is at mgeorgehome. And here's my presentation. So I would like to see any question from you. Thanks.
Thanks for Dr. George Kong. And today in our panel, we spent a lot of time to discuss about the stress and the mental health issue, because without mental health, we can call it the whole health. Yeah. In the pandemic of COVID-19, we spent a lot of time, resource to deal with the disease, but we spend really resource on the mental health issue. So today, after for our slide and our share, we want to focus again about the mental health and the positive advocate for mental health. And while Dr. George Hong mentioned about the social determinant of health, I want to echo to him the social health inequality equal and usually means the social inequality, especially the gender inequality also shows times a stress or discourage for all the issue. And today, let's our slide and our share. I also see our mental health association in Taiwan's former chief, Professor Zhang Jue, also listen to us. And I want to invite, if anyone want to ask question or want to share with us, would you please raise your hand and we can invite you to be a speaker. No? Okay. Okay. If you don't have other question or other feedback, our slide will share on the file on the flow at the NGO6W. And if anyone need to contact with us, you can also contact with our profile and in public. Okay. So,
Sorry, can you hear me?
Yeah.
Yeah,
Professor.
I would like to make a quick supplemental about my topic because I just realized when we doing this presentation, we just ignore about the domestic violence during the COVID-19, and domestic violence and divorce rate has been increased during the lockdown and in Victoria. It caused very substantial increase, and also there is a term I don't know whether you other people will realize this hashtag or not, but there is a hashtag about hashtag COVID breakup. So I don't think you would know because during a lockdown, all you can do is just living together, and there is more arguments and there's more fight. And I heard lots of story about COVID breakup. So that including with the Melbourne as well. But unfortunately I did not present this today. But I will add this material into my slide. I will forward to you. Thanks.
Okay. If anyone have other feedback or other question? Since I never know. Okay. Today our session will be finished. And again, I like to thank our speakers, their share and their research. And I also I appreciate for your warm feedback or your question. We hope we can have more network or connected with each other to share with our experience to all over the world with all our sisterhood. And again, I want to thank for the Mental Health Association in Taiwan. Thanks for their inspire and their assistance. And also I want to because three of us come from Taiwan. This year, Taiwan's Women's Rights Association also give us a lot of assistance, including our space and the network and the advocates with the government. We thanks for them again. and how next year we can see each other in New York, or we can see people in person, not only on the internet. And if there are no other questions or other feedback from our our honored speaker, and we will say goodbye to all of us. And if you have any question, you are welcome to contact us or send a message on the platform. Okay, so I will thank you again. And also the sister Mavi also give his email to us. So if we have other question about the homeless woman issue in Taichung, we also can contact with her. And thank you again. Thanks for your listening and thanks for your feedback. And I appreciate this chance we can communicate with all over the world against the gender violence, against the lack of the mental health resource. Hope we can see each other in other place. Okay, thank you. 我们是要拍个照。
Wow.
George Hong, Dr. George Hong, could you say, show your face? Maybe we can have a screenshot. Okay, so I don't know how to make this screenshot. I try. Was you? Okay. 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 See you.